Well, let me add my very brief welcome to say good morning to you. I'm Simon Day from the UK and I'm chairing this first session. We just have 3 speakers. I won't take up a lot of time introducing them because we want to hear what they've got to say. But I'd like to welcome our first speaker, John Forman, who I think probably everybody knows by now. I've got to know John quite well over several years. I first got to know him at ICORD meeting because he was the one who always used to turn up, but his luggage didn't. So I was slightly worried when I was chairing the first session as to what he would be wearing, if indeed anything. But it seems to have worked out this time. So John is currently the president of ICORD. He's from that place far, far away called New Zealand. He's done a huge amount of work in patient advocacy, lobbying governments and so on. And he's going to talk about ICORD's vision, which is something we were talking about at the board meeting yesterday. And in particular, he's going to tell us a bit about the Yukiwariso declaration, which, if you don't know anything about it, you're here. If you want to find out more about it, you can actually find it on the ICORD website. So I'll hand over now to John. Thank you.
Thank you, Simon, and hello again to all of you. It is great to be here in your beautiful country. Those images are just absolutely spectacular. They were a real delight. I'm going to talk to you about one aspect of global strategies. And the big issue, of course, is that when we look at places where there have been successful efforts to establish good laws and good policies for rare diseases, it highlights that many other places where that is not the case. And a big part of ICORD's mission is to try and influence those places, those countries which have yet to implement good laws and good policies and good medical services and research incentives and access to orphan medicines and so on, so that all patients with rare diseases in every country in the world can enjoy the same sorts of benefits of those who are in the lucky countries. First, a bit about me. That is me with my family, my wife Judith and my twins, Timothy and Holly. And I mentioned that they are both affected by a rare lysosomal storage, which is alpha mannosidosis. And most of you will not know that particular disease, but like all of the lysosomal storage diseases, it is progressive, it is relentlessly progressive, and things get worse over time from some early beginnings where it was not clear that there was even a problem. So that is what got me involved in rare disease issues. And I've been involved in many levels, setting up the New Zealand Organisation for Rare Disorders, which I was the executive director of for 15 years, after spending a couple of years developing the organisation, and currently, as you're aware, the president of ICORD. A little bit about ICORD, because not all of you will know the organisation. It was formally established in 2007, although it had been holding conferences since 2005. And this is the 10th ICORD meeting, so it's a significant event. Now, the important feature of ICORD is it is multi-stakeholder. It welcomes individual membership from anyone who has an interest in rare diseases. And you can see there the list of the types of people who get involved in the organisation. We are looking forward to having a meeting next year in Cape Town, and we hope that many of you will make the effort to get there, and we are forward planning for the possibility of China in 2017. A big part of our mission, although we've had a number of meetings in Europe and one in North America, a big part of our mission is to move away from those places and to have our meetings to be missionaries, if you like, with our message to the rest of the world, because there is so much of the rest of the world that needs the support of other rare disease advocacy groups in order to achieve the sorts of gains that have been made elsewhere. ICORD has prepared a policy statement, the Yukiwariso Declaration, and the name Yukiwariso is a rare flower from the Hepatica family, and it was the Japanese name for that flower. It was chosen because this was launched at our meeting in Japan. There are two versions of this. One was a summary version of it, which was published in Acta Pediatrica, and the other one is the full version, which is on the ICORD website, and there are translations of it into Spanish, which are here at the meeting, that you will be able to get your hands on. And the Spanish version will also be posted soon on the website. This declaration, it offers a framework and a rationale for why all governments should adopt a rare disease policy and action plan. And it is intended to speak to governments and to international health agencies such as the World Health Organization and the UN Development Agency and the World Bank. Because we think the message needs to go to that level, and it's really important that it goes to that level. The declaration has 6 principles in it. I won't go into a great deal of detail on these, but the most obvious statement that rare diseases are, in fact, a major public health issue. Sometimes that is not how governments or the international agencies understand the impact of rare diseases, and that message has to be made very clearly to them. It then talks about human rights and government duties are involved in the discussion here. Those who are successful in getting good health service and good policy for rare diseases do not just get them by magic. They do not fall out of the sky, and they're not entirely because of the kindness and generosity of politicians. Having politicians who are supportive is very, very helpful, but at a very fundamental level, it is a human right, and we must always come back to that basic consideration as we debate these issues. And we encourage in the declaration for governments to support rare disease research and product development, to take a comprehensive of all aspects of rare disease needs, from the cradle to the grave, if you like, from pre-pregnancy right through maternity care, through pediatric care, through early adult life, right through to the end of life. All parts of the needs of that continuum needs to be provided for, including the necessary social supports and education support and so on. So that it looks at all aspects of the impacts of the rare disease need to be considered by the policymakers. And in all of this, it is so important that the autonomy, consent and the information needs of patients are always to the forefront. And patient groups need to be directly involved in the development of policy and services. The declaration then proceeds to give 12 guidance points, which is advice on how governments could implement some of these principles. Now, you'll probably thank me for leaving out discussion of the 12 guidance points, because that would be perhaps a bit too much for this session now. But one of the guidance points talks about the importance of recognising the need for rare disease policy and action plans in the developing world. We have to admit that our own policy document is a bit light on the sorts of analysis or advice that we would give to government about the developing world. And that, I think, is another piece of work that we need to do, and that we are in the process of gathering thoughts and ideas perhaps for another publication. The big question is that how to effectively promote rare disease policy and action plans in the developing world when there are so many fundamental health needs which are challenging. Right? And that's a major challenge for all agencies, not only for ICORD, Rare Diseases International, but also the World Health Organization and the UN and the individual governments. And I think it is fair to say at the highest level in those international government and cross-government agencies such as the WHO and the UN agencies, they do not give a lot of time and a lot of consideration to these issues, and they need to do better. It is perhaps easier to argue the case when for consideration for rare diseases when primary care and public health are well established. Because it is easier also for politicians to be a bit generous in offering provisions for rare diseases when there are plentiful resources in the country. But many of them rely on linear development. In other words, we will do our first priority first, and our second priority second, and then our third priority. And rare diseases are always way down the line, at perhaps 15 or 20, and in some cases not even on a priority list. So that's the linear approach, and that is the fundamental argument of many health policymakers and governments, is to say, well, we have other things which are more important. But the right to health applies to everyone. It applies to people with rare diseases, just as those who are in need of vaccination programs and good quality primary health care and so on. So the argument of leaving rare diseases in a state of neglect or parked in the parking lot while they deal with anything else, that's the reality of what we often get, but it is not acceptable. We need to focus on a number of important principles, I think. There is a principle called progressive realization, which is in international law, which says that when there is a right to health, every government has a duty and a responsibility to improve the situation from the point that you are at. And progressive realization means providing some improvement for everyone. It does not just mean cherry picking, I think is the phrase that we use, of selecting the things that you want to pursue and leaving the others in a state of neglect. So it's all sections of the community. It's the most fundamental human rights, in fact. And also, in the developing world, people with rare diseases end up with a double or even a triple disadvantage because they are faced with poverty, limited basic health care, and also a lack of provision for the particular needs that are associated with their rare disease. And obviously, without access to basic health care, rare disease patients have a much higher mortality, greater morbidity, and compounded social disadvantage. So establishing the basics actually improves the outcomes for all of those, for everyone, including those who have rare diseases. And looked at it from another perspective, the basics are an essential platform for those with rare diseases ever to get their particular rare disease issues addressed. There are some models to consider, and this one I think is a very important consideration, and maybe not so obvious. It has been around for many, many years. In 1999, a group, the WAOPBD, which is the World Alliance of Organization for the Prevention of Birth Defects and Developmental Disabilities. Well, what a mouthful. They are a group of mainly geneticists who developed a set of principles and guidance of practical ways for implementing genetic services in the developing world. And they have worked hard to achieve that, so that diagnosis and prevention and care can be provided even in those countries which are really resource constrained. And it's, I think, really significant that they were developing their ideas and putting their advice together 20 years ago. And it's, I think it is still a good and relevant model, and I'm pleased to hear from the representatives from South Africa who know some of the key authors for this, that some of the people associated with us are currently revising this document and aiming to update it. And I think that's a good model because it actually provides a formula where you can have parallel development of specialist services, and so that you do not have to wait for this linear approach of one thing after the other. And it offers some very good insights into what can be done. In the Philippines, and excuse me, I'll probably mangle the pronunciation of Kalusugan Pangkalahatan, it's the principle of universal health care, a policy that they brought into place. They introduced what they called a sin tax, a tax on alcohol and tobacco. And since 2012, they have doubled the public health expenditure. And that's a remarkable achievement, I think. They extended health insurance cover to an additional 45 million people who previously did not have that coverage for hospital, surgical and expensive therapies and treatments. And in the process, the figures there, 1,000 more doctors, 10,000 more nurses and 6,000 more midwives. That is an example of a government realising its obligations and deciding that it just has to do something, and it cannot allow the relative neglect of a large portion of the population to go without adequate provision. And I think it's a remarkable achievement. I think that's the extra 45 million is about the population of Spain. It is twice the population of Australia. It is remarkable, and it shows that when there is a will and a commitment, these things can be done. And although what they are doing is providing general health care for all of those people, in doing that they are providing the basics, a solid foundation and a necessary foundation, so that the people in that country who have rare diseases will ever have any hope of diagnosis or care. And I think that that's just a remarkable model and something which could be a shining example to many other countries in the world. Now, if we combine the models, if we have a broader approach to basic healthcare provision and universal healthcare, as well as these insights from how the genetic and other services can practically be provided in countries which do not have a huge level of sophistication in the health service, then there is a significant opportunity for significant gains for considerably more people who have rare diseases. And so it would avoid the unfairness of the linear approach, because it would have parallel development, moving everything forward at the same time. And of course, comprehensive primary and public health services need to have some specialist services such as pathology and clinical genetics and laboratories in order for them to operate and to do what they do. And those things then provide a foundation for the sorts of specialist services that people with rare diseases need for their particular conditions. So recognising that there are many different stages of development in different countries, different stages of wealth and sophistication in health services, is no reason for saying, oh look, this is too hard to deal with rare diseases. If there is a will, even in some of the poorest countries where there is limited resources and limited capacity in the health care system, it is still possible to deal with some aspects of the need for rare diseases as progress